Thank you, Ian. Thank you, Dr. Ali and Councillor Santos. We're really here to try and clear up as many questions as possible, because this is a very fluid situation. It's moving all the time, and we want to try and do our best and to try and read out all the questions and keep us in check. If I could ask Mahbub to read out any questions, and we'd be more than happy to try and answer all of them. And of course, we've got Dr. Ali, Councillor Santos, Ian Diley, and myself. Thank you, Mahbub. Over to you.
Okay. Thank you very much, Cllr Athwal, and thank you very much, panel members, for your concise summaries. And obviously very grateful to the members of the public who are watching this evening and have submitted a series of questions whilst you were metaphorically on your feet. So I'll start off with a couple of questions we've had from faith leaders asking for advice about congregations, advice to on religious worship. So could I remind you of the advice that was given last year about faith to faith groups in the borough, and ask Dr. Ali if you would helpfully start off with your thoughts on the advice that you would want to give to faith leaders in the borough.
So I think the first thing is safety is paramount. As yet, there hasn't been any official guidance from the government, but social distancing, hand washing, those things, face coverings, all of these three things still come into force. Until we hear further about, gatherings and, what the guidance is, I think probably the best thing to do would maybe to minimize time on site. And again, just to reiterate, social distancing, face masks, and sanitization.
Thank you, Dr. Ali. That's really helpful. Mr. Diley, from a public health point of view, please let us have your thoughts on this really important topic.
Yeah, I'd agree entirely with what Dr. Ali said. And what I'd add to it as well is for gathering with other people, as we do in faith settings and in any other kind of setting where we're meeting lots of people we don't normally mix with necessarily, having an LFD test before we go in just to check our COVID status is a really important step as well. So I explained a little earlier about how to get hold of those, but they're a really valuable tool for us when we're moving into those kind of higher risk situations where we're meeting other people. So I'd add that to Dr. Ali's advice as well.
Thank you, Mr. Diley. And Cllr Athwal and Councillor Santos, residents of the borough will be aware that you've kept in regular contact with faith leaders throughout the pandemic. And from your perspectives, please, what advice would you like to offer?
Thank you, Mahbub. I think the advice is really simple. It is what Dr. Ali said. We've got to be at our most cautious at the moment, because the pandemic is, it's spreading like wildfire. And what we have to do is have those circuit breakers in place. I can talk about my own personal experiences. My mother-in-law, she's very elderly. She likes to go to the Gurdwara. And yesterday we had a long, a conversation. Perhaps if you're going to go, I'll take you there, because I know religion plays a huge part in people's lives. And what we have to do is perhaps go at other times when the place of worship is not as busy, and spend some time there. So we have to make those little alterations in our way of life, but also keep making sure that people's faith, people's mental health, everything that we're worried about, we look after that as well. And of course, all those cleaning regimes that we've got in place, we must step them up in places of worship, even more so this time, because this variant is far more infectious than the last one. Doubling every 2 days, we will be on the brink very shortly, unless we really take care and I'll heed Dr. Ali's advice and what Ian has said, lateral flow tests and the cleaning regime, and of course, slightly altering your behavior. And if you can help it, go at other times when the place of worship aren't as busy. Try everything. We must work together, and we'll come out of this stronger as we go through the next 3-4 weeks, which what's in store for us. Thank you.
The only thing I would add to that, Mahbub, is to ask faith leaders, as they have been doing all through this pandemic, to encourage their congregations to get vaccinated, and to encourage their congregation members to take that message out wider to their families and friends and to their social networks, and the importance of getting vaccinated. I think we've said this statistic already. 82% of the people in critical care in hospitals are people who are unvaccinated. It just demonstrates how important it is to get vaccinated. And it's also important to know that 2 are not enough. So the evidence shows that 2 vaccinations does give people some protection, but actually to get the maximum benefit from vaccination protection, you need to have that booster jab. Some people will need to have 3 jabs in the first instance of part of their course, and then they will get boosted, have a booster as well, but you need to have that booster jab.
Thank you very much.
Sorry, if I can just come in. I mean, the evidence suggests that having 2 doses gives you like a 66% protective cover, but the booster will push that into over 95%. So it's quite important that everyone gets their primary course and then has their booster afterwards.
Dr. Ali, thank you very much, because you've started answering the next question. That's amazing. Just to finish off on the question around faith leaders, it was the Reverend Andrew Mumford from Broadmead Baptist Church in Woodford who fielded that particular question, and I'm sure that through Cllr Athwal's good officers that a meeting could be convened for faith leaders to discuss this in much more detail, and particularly the point made by Councillor Santos to use faith as a means to encourage uptake of vaccinations. Dr. Ali, you started answering the question. We've had a number of residents who have been asking about the efficacy of vaccinations, and some of the questions range around how to book a test, how to get a booster, and how to get a vaccine. And can you start off by just telling us what you've been doing today and how busy it's been in the vaccination hub at Redbridge Town Hall in Ilford?
So I've been at the Ilford Town Hall since 8 o'clock this morning, and we opened the doors about 8:30. We've been vaccinating all day. Just as I broke off to come upstairs for this meeting, I think we'd done about 12 to 1,300 patients. I'm not sure of the exact count. So that's what I've been doing today. Now, one of the important, I think the other question you asked was, how can they get a vaccination? So yeah. You can go online. There's the national booking system, and that's the easiest way to book in a vaccination. When you go in via that system, it will give you a list of all the areas that are around you. It won't just take you to one vaccination centre. In Redbridge, there's quite a lot of places where you can get vaccinated. A lot of pharmacies are doing them. You've got some of your slightly bigger centres, so for example, King George's. We're at the Town Hall, and then you've also got a site at Hawkey Hall. As well as, and if you can't find a booked appointment, if all the booked appointments are gone, Hawkey Hall and the Town Hall are doing walk-in clinics. If we're open, whichever days, so the days that the Town Hall is open are Thursdays from 8 till 7, and on the weekends from 8:30 till 7. You can walk in and you can get your jab done. You can get your first one or your second one if that's due, and if you're due your booster, you can come in and get your booster as well. If people don't want to have to wait in a queue, then like I said, the other option is the national booking system, and that will give you everywhere locally that's currently available that's got an appointments. Just to add, at the town hall, we will also be open on Christmas Day and Boxing Day for anyone who, because we know some people are working, they can't get time off, and we know it's a 4-day bank holiday. Christmas Day, Boxing Day, if anyone does want to walk in or if they want to make an appointment, we will be open.
Okay. Thank you very much, Dr. Ali. And for the residents who are viewing this, I just want to say that we will run the session longer because there was a late start, but Dr. Ali might get called any minute to go and vaccinate some of our fellow residents. So if she leaves early, please understand that's the reason for it. On the same theme, Cllr Athwal and Councillor Santos, over 90,000 of our residents in the borough are not vaccinated. Surely, how much of that is a concern for yourselves, and what would be your messages to those residents?
It's an absolute huge concern for us because we want to vaccinate everybody, and sadly, we are not any different to the rest of London. London, on the whole, is about a third unvaccinated. And what we're now looking at is areas where perhaps the vaccination rate is lower, and we want to send our engagement teams into those areas, making sure that we try and talk to everybody. And as Councillor Santos said, I think faith plays a huge role in our lives. And if we could really sort of ask the faith leaders that they are the role models that people will follow. And if we can actually keep sending that message out, that the council, the NHS, are doing all they can to make sure that the facilities are open locally, they're open for longer, and there's more of them. And all they have to do is just rock up and they can have the first vaccination, the second or the third, whichever one that is needed. But it's a huge concern for us. We've got to get more people engaged with us, and we're certainly sending out our engagement teams into the areas where we know vaccinations are a lot lower than some of the other areas where we're hitting somewhere near 80–90%, and in some places the booster is only around 20%. So we know where those areas are, and our teams are out in those areas making sure that residents are aware that they need to get themselves protected and quickly, because this is infectious and it's going to catch up with all of us.
Thank you, Councillor Athwal. Just to put to Councillor Santos a slightly different question, but on the same theme, that from as Cabinet Member for Health and Social Care, you're probably aware that in hospitalisation of those who are not vaccinated is very high. Could you just give us your views on the impact on the health service of people not being vaccinated?
I mean, as I said, thanks, maybe. As I said earlier, the figure for the people who are in critical care and are unvaccinated is about 82%, and so it's a real worry that if you are unvaccinated, the likelihood, there is a greater likelihood you'll have more serious illness, and some of that might require you to go into hospital. We're also in that period of the year, the winter period, where demand in hospitals, whether it's flu, whether it's the respiratory conditions that children get around this time, whether it's falls, they're all on the increase, and COVID adds to that. And there is a real risk that our NHS may become overwhelmed, and that will be disastrous for all of us. And that's why it's really important for people to be vaccinated. We've got a useful social media graphic that's just gone out, and Mahbub, I don't know if we could ask the team to perhaps put that in the chat. It's on our Facebook page and our Twitter page, and that sets out all of the different opportunities there are for vaccination. And I would add that we all have a role to play within getting our community vaccinated, to talk to our family members, to talk to our neighbours, to get involved the voluntary and community sector organisations, and to get them to use their channels and their platforms to get out the message and the importance of getting vaccinated. And as Councillor Athwal has said, also faith leaders and other community leaders to get that message out. The risk is to individuals, the risk is to our NHS, and the impact on our NHS will have a wider impact on all of us. There's already a backlog of people of treatments required from previous waves of this pandemic. We don't want that to escalate. We don't want to have to put off any further other treatments because the hospitals are overwhelmed in dealing with COVID. And whilst the last point I would make, sorry, Mahbub, is not only get your COVID vaccine, it's actually a really good idea to get a flu vaccine if you haven't done so already, and protecting yourself, protecting your neighbours, protecting the NHS from becoming overwhelmed. I'll stop there.
Thank you very much, Councillor Santos. So the message is clear. As a community, we all have a responsibility to save the NHS so that patients can be treated. There's a just change in tact to another direction of questioning. We've had a number of people asking us about public places and being safe in shops and supermarkets. If you remember, last year there were stringent controls in social distancing or attempts to ensure that supermarkets and other places were not overwhelmed with shoppers. With Christmas coming up, and we all like to get out there and get our Christmas presents for our loved ones and our friends, what advice, Mr. Diley, would you give to residents?
Absolutely. I think the general advice that stood this time last year stands again, really, in terms of how to reduce your risk and risk of passing anything that you have on to other people. And that is about keeping that bit of distance between other people, wearing the face coverings when you're going indoors to places such as supermarkets, etc., where you have large numbers of people. So that advice remains the same. What we are doing within the council, we have our environmental health officers and other teams that work with businesses to support them to put in place anything they can do to facilitate that distancing and make sure that people are reminded to wear their face coverings. So we're working across the borough with all of our businesses to try and support them to enable this all to happen. I think I wanted to add a little bit more about the vaccine as well, if that's okay, Mahbub.
Yes,
just
please do.
Mark, Councillor Santos's earlier point about that graphic that gives you all the details about locations and days and times when we've got clinics running. I just wanted to note as well that we have Fulwell Cross Medical Centre. I don't think it got mentioned earlier, but that's another place where we can get walk-in jabs. So just for the people on the call here tonight, it's another useful piece of information. It's also worth noting that it's a really ambitious target that's been set to the country for getting jabs done by the end of December. It's been an ambitious target for Redbridge and the rest of North East London. And all kinds of resources are being put into making sure that can happen. And potentially down the line, we may have even more options for where you might be able to get your jab. But at the moment, we have a really wide variety of places where you can go and get that.
Thank you very much. Just on the retail and the business question to Councillor Athwal and Councillor Santos, how will the council be working with local businesses to support them at this very busy period? They've come through, a difficult trading time during the pandemic. Councillor Athwal, please.
Thank you, Mahbub. I think we've already started. I know I was in a meeting with the LGA, the Local Government Association, where across the board we're trying to lobby the government that they need to step in now. We're working with London councils, with all the other 32 councils, including the city, to lobby the government that the taxpayers' money needs to be used now to help the taxpayers get out of this problem that we find ourselves in. So there's going to be financial issues that are going to be coming up, because businesses will not have the kind of custom that they were hoping for. So what the government has to do, and what the council will do, is as soon as we receive the money, which is the taxpayers' money, nobody else's, it's ours, and that money will be distributed equally fairly to all the businesses who deserve it. And we're on top of that, working with other councils from across the borough and across the city and across London to make sure that certainly our business rates and our council tax money is used wisely at this particular moment of time to pay some of the people out of the hardship that they will definitely face over the coming weeks and months.
Thank you, Cllr Athwal. And that reference to people who are the lowest paid and are on 0 hours contracts, if they isolate, they lose money. So thank you for, on behalf of residents in Redbridge, lobbying government for the hardship payments to be reinstated. Councillor Santos, we've had a few questions about what should other residents do when they observe their neighbours, people in supermarkets or on public transport, not following the rules. What can they do without putting themselves in any danger? What would be your advice, please?
So my advice would be, if you feel comfortable to challenge someone, do so. But as you say, Mahbub, not to put yourself at risk. And I think also that we should start to encourage people to feel comfortable to be challenged, because sometimes you go into a shop and you might have forgot to put your mask on, so it's okay for someone to say, to give you a gentle reminder, and you go, oh, yes, of course, I'll put it on. But otherwise, to report it to shop staff, to report it to the security staff, to report it to the train staff, that if you see it or witness it, would be my advice around that. And actually, it's become law now, so people can be fined for not wearing face coverings in those places. And so I think it's really important, really important for us to either challenge people where we feel comfortable, or to report it to the shop staff, or to security staff, or train staff.
Thank you very much, Councillor Santos. And Councillor Athwal, we've had questions around littering. I realise that this is not something that you were expecting, but some residents are concerned about discarded face masks and being a eyesore in parts of the borough. Is there anything that you'd give out as a message, and what do you think the council could do?
I know the council teams are out across the borough on a daily basis, making sure that the streets are swept up and the bins are emptied, making sure fly tipping is picked up, and that has been stepped up. And ultimately, we as residents really need to take some responsibility. We're living in the middle of a pandemic, with the face masks are there not just to protect you, but to protect others as well, and simply discarding them is wrong. I think we will go on a comms offensive to make sure that people understand this. However, we also have to realise it's not those council officers, it's not the councillors that are putting this on the streets. Residents have to take some responsibility. How hard is it with so many bins around to just deposit it in a bin? It's not difficult, and but we will carry on regardless to make sure that we pick up everything we find, making sure that our staff are kept safe as well, because don't forget, our staff are just as prone and vulnerable to being to this pandemic. And there are horror stories coming from across London and the country where people are now signing off sick simply because they've got COVID-19 and they have to self-isolate, and that's going to be in whole departments, especially with a virus that is so infectious as it is at this particular moment.
Councillor Athwal, like Dr. Ali earlier on, you've started answering the next question, so that's brilliant. And the question is around the keeping council services running, such as refuse collection, social care, etc. Would you kindly share with the audience conversations, discussions that you've had at local and London level on ensuring that public services continue? We know there'll be huge pressures on those, as you've highlighted, but your thoughts and reassurance would be very welcome.
Thank you. I think we were one step ahead in this one, because once we realized how infectious this particular variant was, we made sure that the call to work from home, whilst the Prime Minister said from Monday, we went working from home straight away. We're trying to avoid any kind of contact with each other and making sure that the call went out to different departments, perhaps departments who haven't got front-facing issues. So therefore, we've got maybe the planning team being trained up and making sure that they can answer the contact centre, and also a list of volunteers from different parts of the council to be able to pick up bins. So we've been doing all this sort of a contingency planning, resilience in business continuity for some time now, and we'll continue to do so. But that, of course, doesn't mean that we will get through this unscathed, because of the rate of infection, as Dr. Ali said, you know, every 2 days it's doubling. And it's going to catch up with us at some stage, but we are putting all the plans in the background to ensure that we can carry on doing all the things that our residents expect from the council. And I think across the whole city, other councils are working in a similar fashion, making sure that we can rely on those services when they're most needed by our residents. Thank you.
Yeah, thank you, Councillor Athwal, for those assurances. And I guess we could probably take it from what you've said is that at some point we will see yourself and your cabinet colleagues emptying bins out on the streets. And thank you for that commitment to local services. I just want to bring.
I have the uniform and the boots from last time, so if the call comes, have boots will travel.
Excellent. And those residents who have you on their round, I'm sure they'll welcome you with mince pies and anything else. Mr. Diley, you were wanting to come in. Please do so.
Yes, thank you. I just wanted to add to what Councillor Athwal had said about the fact we've got really robust measures within the council for keeping our council colleagues safe. We've got LFD testing access for people. We have face coverings that we use inside our buildings here. We have, and as Councillor Athwal noted, we've been working from home wherever possible since we discovered quite how virulent the Omicron variant is. The other thing I wanted to note about that is part of the reasoning behind the Plan B measures with the 7-day daily LFD testing. So I think many of us will remember this time last year where we had lots of people who were identified as contacts of cases who were having to isolate, and it did have an impact on people's ability to continue operating in businesses around the country and in organisations such as our own. So that's part of the rationale and the logic behind going to this 7-day daily testing for contacts as well.
Okay, thank you. And a couple of very contentious questions. One is from residents asking why can those who are not vaccinated be forced to be vaccinated? I mean, the background of the question is that they're very concerned that up to 90,000 at the start of this week in Redbridge were not vaccinated, and that is a similar picture across London. And health service staff will, by the end of this financial year, by 31st of March, have to be vaccinated in order to work on the front line. So is there something that the panel would like to share their views on, whether compulsory vaccinations should be in place or not? Councillor Santos, would you like to have a go at that question, please?
I think the way that we'd like to address it is not to force people to have vaccinations, but to actively encourage them and to spend time to understand what people's hesitation is around having vaccinations and to answer and address those questions. We heard from Dr. Ali answering some of the questions around fears that pregnant women might have about getting vaccinated. So it's really trying to understand what the issues are for people, or why it isn't that they're not getting vaccinated. Is it about issues? Is it also about access? So that's one of the reasons why we're making sure that we have vaccinations available on Christmas Day and on Boxing Day, so that we really do, it's a real demonstration of how we're trying to promote access to services. So really important that I think the approach we take is around actively encouraging, and we've all got a role to play within that. I think if we start to call people stupid or force them down directions, people get their backs against the wall and they stop listening and they stop having those conversations. So we want to have those conversations. We want to try and persuade people. We want to overcome the barriers that there are to them actually getting vaccinating, and that's I think the better route to travel down in the first instance. I mean, clearly there are some professions where having a vaccination is important, and that's why the government has done mandatory vaccinations within the social care industry and social care workforce, and also within the health care workforce. I mean, and that's for very obvious reasons about the nature of those roles, but otherwise it would be very much about persuasion.
Thank you. Cllr Athwal.
Thank you. And I think the medical profession who've been asked to be vaccinated, I think is only right, because they are looking after some of the most vulnerable in society, and the fear of inadvertently giving the infections to the patients, as we already know, a lot of our doctors have to have certain immunizations before they start practicing. So this is not something new. This is something that's been there for a very, very long time. And I know that even medical students, when they first sign up to become doctors, the first question they're asked is, have you had these set of immunizations? And if they haven't, they have to have them beforehand. So this is nothing new. This is just something following on from what we've been following for a very, very long time. I suspect the difference this time is because we were threatened so suddenly that obviously the vaccines had to be developed in super quick time to save humanity, really. And as time goes on, people will have less fear and more people will get vaccinated. And what we have to do is try and work with those residents, try and really show them the benefits. And once we've shown them the benefits, and the facts are now starting to come out a year later, since when the vaccine first came out, the hesitancy is starting to go away, but we've got to work harder because there's a lot of work to be done yet.
Thank you, Cllr Athwal, and thank you for your comments earlier regarding the door-to-door visits by others. I'm going to pause for a second because I've been sent a message that the live feed has temporarily frozen. And then we'll recommence. I think the live feed is down. I can see, and then as soon as it's up, we'll just come back. And I think I might have to start off by asking Cllr Athwal a question around working in partnership with the Shadow Secretary of State for Health and ensuring that messages are transmitted into central government about the role of local government. Thank you. We're back live. Apologies for that small interruption. I can assure you it wasn't a commercial break. We don't run any advertisements on this Redbridge channel. Cllr Athwal, you must be extremely proud that Wes Streeting, former deputy leader of this council, is now holding one of the high offices in Parliament as Shadow Secretary of State for Health. Can you tell us what conversations that you have been having with Mr. Streeting about the situation in Redbridge and London, and whether he is on the side of Redbridge and other councils transmitting those into central government?
Thank you. I think Wes has been a tremendous ally, and as many of you know, I think Boy Streeting was destined for greater things, and he's certainly landed a real good role, and we wish him well. But in having him there, I think it's really helped us, because it takes the message right into the heart of Westminster. And as we saw the other night, common sense prevailed, where Councillor Streeting, ex-Councillor Streeting, now Wes Streeting MP, was leading the charge in making sure that all the bills that needed to pass were passed through, the legislation that needed to pass through. And I'm in regular contact with Wes in terms of getting anything we want done, anything that is early warning for him, for us. And therefore, we're reaping the rewards of having a local MP in such a high role in Westminster, and we will continue to do that. And hopefully, that role will not be a shadow, and he'll lose that shadow, and he'll actually be the Minister for Health.
Thank you, Councillor Athwal. I just want to fire some quick questions at Mr. Diley before then asking the panel questions around mental health support. So, Mr. Diley, we've had a few quick questions which are around the following. Can you have the booster if you are a week short of the 3 months after the second jab?
As I'm aware, as far as I'm aware at the moment, you need to have got to that 3-month period. You can certainly book your appointment at least a month in advance to do that. So if you have 2 months since your second dose, you can book it for a month's time. But as far as I'm aware, they are going to that 3 months period.
Okay. Someone who is over 73, they are type 2 diabetic, and they've had a second dose. They're asking, do they need a booster, or do they need a second booster?
They would, I suspect, need a booster on top of their second dose. If they've got specific concerns about any of us have got concerns about any specific conditions that we do have, and how that works in terms of boosters and first and second doses, then a chat with the GP is certainly the first place I would go to for them, and that's what I would advise. But the great majority of people will be have great benefit in having all 3 doses of their vaccine.
Yes. What advice would you give to residents who have a phobia of needles? Some people genuinely have this condition.
Yeah, I think that's that can be a real challenge for individuals for all kinds of health processes that involve needles. What I would say is, from my own experience, having seen it at vaccination centres, how supportive and how understanding so many of the staff are that are working in these vaccination centres in helping people who've got phobias around needles, and they will do everything they can to put people at ease and help people through that process. And I've seen that with my own eyes, how well that works. So I entirely understand how unpleasant that could be if you do have that phobia. But the whole process of getting your jab is a very, very quick one once you're through to that clinical room, and you have a very understanding set of people and supportive set of people in that room when you get there. And the benefits of having the jab are huge.
The staff are wonderful. I mean, the way they look after you, it's amazing, and you just have to go there, and they will see the fear, and they will take that fear away. They will put you at ease, and they will help you. They're wonderful, wonderful people.
Mahbub, there's just one more thing that's just reminded me in terms of vaccination that'd be really useful to note, is for people who are going to walk in sessions of vaccination and are queuing up there. there are staff from the vaccination teams who will be going down the line, and if there's anybody who's particularly vulnerable, say particularly we have one of our older members of the community, or mum with a, or dad with a young baby, they can be prioritised and their vaccine expedited in the queue. And I think most people in that queue will understand that and support that. So if anyone is struggling with queuing, for instance, all of the teams that are doing the vaccinations are trained and understand that they can come and get that person jabbed quickly as possible.
Okay, thank you, Mr. Diley, because that takes us on to the last of the quick fire questions, which is someone who lives with parents who are elderly and have serious underlying conditions. They're unable to book their booster on the NHS website, but are struggling to leave their parents at home to queue. Is there a service at the moment that's currently available, like an outreach service or home visits?
We have with the NHS vaccination services, they've been prioritising and concentrating hard on those residents who are housebound. So for people in the kind of situation you described there, it's approaching that kind of situation, isn't it? So we do have outreach services. Again, I think having a chat with the GP in the first place about trying to arrange for that to happen would be the first point of call. I think anybody who is really struggling with that can always come to us as well, and we can help expedite and facilitate it to happen if people are particularly concerned about that. But we do have outreach services that have been going out to people's homes to give them vaccination in those kind of situations.
And please do talk to your GPs as well, because to my great surprise, I was canvassing and my GP opened the door, and I looked at him and said, "What are you doing here?" And he looked at me and said, "What are you doing here?" And he was actually vaccinating an elderly couple, and he'd gone to their house to do so. And so I know that service exists because my own GP was I think it was the second jabs that they were having at the time. So, you know, just get in touch with the authorities, whether it's your GP or whether it's the NHS or whether it's the council, will certainly reach out.
Thank you, Councillor Athwal. And to Councillor Santos, should residents or are residents able to contact their local councillors for advice and support? Is that something that you would encourage?
Absolutely, always. So you can find out details of how to get hold of your councillor on the council, or your councillor on the council website, and they'll have a telephone number or they'll have an email. Some may have restarted their surgeries as well. Some had stopped in-person surgeries because of the pandemic. But absolutely, and your councillors will be able to point you in the right direction, or if they don't know the answer to a question, they'd certainly have access to people that do.
Thank you, Councillor Santos. We're coming to the last round of questions. You've been a fantastic panel, and Dr. Ali is probably on the ground floor of the town hall, vaccinating or giving boosters to our residents. So a number of questions have been around mental health support, and going forward, the impact of the pandemic has been felt by people in many different ways. And Mr. Diley, would you be able to share with us the way to access mental health support for any resident who either requires a service or wishes to refer a friend or a loved one into the service?
Again, I know that our GPs are excellent sources of initial help for that, for finding the right service to refer on to and dealing with people at the first stage of that. Also, we have social prescribing services across the borough who are really good at finding good services to help people who've got needs in terms of emotional well-being and mental health as well. There are a raft of services that are out there, and we can put some information out to people through our channels about what is available for people in terms of getting some details to people. But we absolutely acknowledge the impact that the pandemic and the periods of lockdown have had for people in terms of their mental health and emotional well-being, as well as their physical well-being. So there's a lot of work that's being done to make sure people can access what they need to do. And yeah, we'll make sure we put out some information in the next few days to really summarise what all those services are for people that are on this call and the rest of the residents.
That's fantastic. Thank you, Mr. Diley. Councillor Athwal, mental health is an important part of local government services. Would you please want to make some comments about how important it is for this council?
Absolutely essential, because we learned from a lot of valuable lessons from the first wave, the first lockdown, the second lockdown, and the council continues to invest. And I know Councillor Santos in adult social care has and health has been an integral part of that. And I think even how we handle this Plan B is all about looking after, managing and making sure that the mental health is put at the forefront, rather than simply just looking at suppressing the spread of the virus. Is doing both, and I think doing it well. What we'll be able to do is stop the spread of the virus and make sure that all the other problems that arose the first time are eradicated. So I think it's a case of working really hard, and I know money's been invested in this, and I know that the whole thing has been communicated well with our residents, making sure that we do better, learn from the lessons of the last lockdown.
And what advice would you give Councillor Athwal and Councillor Santos to residents who might be worried about their neighbours? Christmas is a time where people come together, but it might not be possible if some of our residents are in self-isolation. Any advice, any thoughts that you would want to share with us?
So, what I would say is that you can still. This is a really important time to, as we've done over the last few years and even before that, to keep an eye out for our neighbours, and if we're worried about them, to give them a knock on the door and to see if they're okay, and to see if they need any shopping or any help. And I know loads of people do that already. And if people are particularly worried, they can get in contact with their local councillor or with a local council, and to raise that concern about their friends and neighbours too.
Thank you, Councillor Athwal.
Yes, and I think we talked about faith earlier as well, because I know the faith leaders played a huge role in this last time. Some of our faith leaders went out of their way to make sure that some of their more vulnerable residents were visited and comforted. And I think that kind of support which the faith leaders gave, and what Councillor Santos is saying, this is a kind of time to raise that awareness, because you may not be able to do it yourself. You maybe if you raised it, others will do it. I know the council ran a lot of services last time, and we'll certainly do that again to make sure that if somebody's lonely, do they get a phone call? If somebody's hungry, do they get a meal? All those things have to be looked at again, because I think whilst we're going into Plan B, it's not quite a lockdown, but it is a lockdown. But what we have to do is make sure we plan as if it is a lockdown, because then we'll be able to deliver those services as well. And we're doing that in the background.
That's very reassuring for residents in this borough, that the council is planning ahead for the potential worst case scenario, but also ensuring that residents receive the appropriate support at this time. You'll be pleased to know, as a panel, you'll be able to relax very soon. This is the very final question, and a number of residents are concerned that GPs have stepped down their routine services like cholesterol, blood tests, and concerned about the impact on the health service generally. What advice would you give to residents about protecting our cherished and vital National Health Service? Councillor Athwal.
Thank you, Mahbub. Some of you may have realised I've got a cough. Thankfully, it's not COVID. I've had 3 lateral flow tests that are negative. I've had a PCR test that's negative, and I went to my doctors because it's it's an infection of some sort. And all I wanted was something for my chesty cough. What I got in return was something for my chesty cough. And I also got here, and I also got the Ventolin pump in case I have a problem breathing. And on my phone, I actually had an email which has got the blood tests, and my GP said to me that if you get an opportunity when you're better, go and get your blood test done. So I didn't have to go in, but I got it all on the phone. And it came through via a text message, an email. And so the GPs are under tremendous pressure as well, because they're working so hard. They literally are having to go to people's houses to vaccinate them. They're having to work in the clinics to vaccinate people, and they're having to do their day jobs as well to look after their patients. And of course, whilst they're doing that, they are stepping up. And if there are any concerns, please do raise it with them, because I know GPs, I have never come across a GP who's turned away a patient. They're always there to help. And what we have to do is make sure that we're living in such difficult circumstances that they're having to do 3 or 4 jobs all at the same time. And they're doing it very, very well to the best of their abilities. And they're compassionate, kind, considerate people who are doing this because they love what they do, which is looking after and making sure other people can get better. And that's what I'm saying is I'm a real example, contacted my GP, and I've got all these things all sorted, even a chest x-ray. I just have to go and get it done. And that's across the whole of Redbridge that GPs are working like this, absolute special people they are.
Councillor Santos.
I think Jazz has given us the answer. The reality is that our GPs are under a lot of more pressure at the moment. And if you look at the statistics, they're actually dealing with a lot more cases at the moment. And people will be aware of the backstory for our primary care services in Redbridge, that they're under-resourced. So they're having to deal with more pressure, and they're still dealing with the situation from a past of being under-resourced. If people are concerned, I mean, the reality is that people are not going to step down care in relation to the management of long-term conditions. And if people are concerned, as the leader said, as Jazz said, to go back to their GP about their ill health, don't stop. And don't delay asking if you're unwell or you're worried about something. That you will get a response from your GP.
Thank you, Mr. Diley.
Yeah, just to add to what the 2 councillors have said, what I think is really, really important for everyone on the call to understand is, if you do happen to get COVID and happen to get that infection, that you seek, if you're struggling with breathlessness, etc., that you do seek medical attention as quick as you can do. Even though our GP colleagues and other health services are all under a lot of pressure at the moment, it's really important to get your help as quickly as you can do. The sooner, if you're in that kind of position with COVID, having serious symptoms, the sooner you get seen in hospital and worked with our medical teams, the shorter your stay would be. That's what the evidence tells us. So don't be concerned or anxious about contacting your GP. If you think you need the support and the help, do it straight away, and don't worry about the pressures that are there.
Thank you very much, panel members, and that concludes the question and answer session of this evening. You've been a fantastic panel, very informative, short and helpful responses that I'm sure residents will appreciate. I can now pass over to Cllr Athwal to continue the rest of the session.
I think, thank you, Mahbub. I think in conclusion, all I want to say is, please follow the guidelines. I know some of them are a little bit confusing because they're still emerging. Follow the guidelines on the council's website. We will be updating them regularly, making sure that we pass over as much information as we can. And of course, in terms of vaccinations, we're doing everything we can to step it up so that we have as many facilities open in the borough to make sure that we can get as many people boosted. And if people need their first vaccination, we'll happily do that as well. All this is being stepped up, and it'll be stepped up even more. As Dr. Ali said before she left to go and vaccinate more people, is that, you know, there will be clinics open across Redbridge on Christmas Day, Boxing Day, because we need to do this almost all the time now to make sure that we get as many people vaccinated and as soon as possible. And all we ask in return from you is please book on the NHS website, book on and get up there. And if there are some there that you can have walk-in, please just do it, because you're not only saving yourself, you're saving your neighbours, you're also saving the NHS. And together we will come through this better and stronger on the other side. And then we will be able to have many more Christmases. And that's all we ask for, residents. Let's work together. This is not a situation that we asked for, but it's a situation we find ourselves in. And we have to work together. We've got each other, and we will come through this stronger and better. Thank you very much.
Thank you, Councillor Athwal. Councillor Santos, Mr. Diley, any final comments before we conclude this evening's broadcast?
Just to echo Jazz's point, it's really important that people get vaccinated. There's no time like the present to get your first, second, your third, and all your booster of vaccinations. Remember, 2 is not enough. 2 vaccinations is not enough to maximise the benefit you need to get that booster jab. You might want to think about reducing your social contacts or prioritise events you'd like to attend accordingly. Test before you go out and about. Wear face coverings in crowded spaces. Stay home if you've got COVID-like symptoms, or even if you've got cold or flu-like symptoms, because we know that they're slightly broader with the Omicron variant. And ventilation is really important. Everything is better outside, although it's a bit too chilly at the moment to be outside. But if you are inside, make sure you do ventilate your home. And as Ian said, if you do acquire COVID and start to get unwell or start to get breathless, do seek medical attention, and especially if you've got some underlying health conditions, it might be worth, if you acquire COVID, to let your treating doctor know that that is the case.
And just to finish on a really positive point, when I look out of the window here in the offices in Ilford, and as I walk around the town centre here, I see all the people that are going to get their vaccinations, the real pulling together of the community, people wearing their face coverings, trying to follow the guidance. The great majority of us are really pulling together to do this, and it's a real pleasure to see it and a privilege to see it as well. So I'd echo everything that Jazz and Mark have said, and just encourage people to pull together and to follow what we've talked about today.
Thank you very much to the residents in our borough who have been listening this evening, and for putting forward your questions. Stay safe, stay healthy, and enjoy the festive season as much as possible. And we hope to see you in the new year. Thank you very much indeed.